Would you love to be doing planks, but they hurt your back, specifically your lower back while you're trying to do them, and you've just taken them out of the routine? Well, this video is perfect for you. My name is Dr. Molly, and I'm with Your Goals Physical Therapy. I think planks are amazing, and if you have lower back pain while you're doing planks, there is a reason, and you can get past it, like without having to worry about surgeries or injections or anything else that kind of whirls around your head when your back starts to hurt. It strictly means that something is not doing its job. But the question might be, well, if planks are the only thing that I notice it in, then maybe it's not that big of a deal, and maybe I should just not do planks. And that's certainly, everybody has to make their choice. But my little root for the plank, right? The being able to do a plank, especially a full plank on your hands and your knees and your toes, that has a huge correlation to being able to do all the other things in your life that you want to be able to do. So even if we start as small as you want to pick things up in your house, being able to do a plank is key to being able to do squats, lunges, and a deadlift. Just the mechanics in that. So, and if you're not squatting or doing the same mechanics as a squat, a deadlift, or a lunge while you're picking things up around your house or moving around in your everyday life, then you're probably causing back problems from just how you're moving. Because the plank is what keeps you steady from your shoulders down to your hips. And that is how you're supposed to move. You're not supposed to flex at that low back. Right? So we're not supposed to have a whole lot of wiggle while if we're picking things up off the floor, we're supposed to lean at our hip and not have this big bend in our low back. So if we're squatting and we can't stop the butt wink, or if we're deadlifting and we can't stop our lower back from curling, then planks are the best exercise for helping you fix that mechanical issue. And so brings me back that if you're having back pain while you're doing it, why can it be so great, right? So we have to get over the back pain to be able to do this wonderful exercise. So how do we do that? Well, let me show you what I typically see from people when they're telling me that they have back pain. So, and it doesn't matter. Some people are on elbows, some people are on their knees, but it's just the most dramatic when you're on your hands and your toes, right? So if you're here, you're set, but then you see some form of sag. So you see that huge arch that sorry, you can't see that. So the huge arch right here, it shouldn't be there because my back is now overly arched. It's not being maintained in this nice neutral position while I'm here. And this is what helps. So there can be several reasons why this is hard. So if you notice how straight my legs have to be. So if the front of my thighs are really stiff, that's going to be hard for me to get to. If my stomach muscles are not strong enough, that can be one of the reasons. And if my lower back muscles are really tight, that can be another reason it's hard to get into that position. So, and that's kind of just scraping the surface. There are other reasons that it can be hard to stay on your toes and do that. And one way, quickly, just to help build up your strength is to modify that position. So either just being on your hands and your knees or being on an elevated surface. If you're in the gym, putting your hands on a bench and then trying to maintain that neutral spine position while you're in the plank, that's a nice modification. But if that's still too low for you, most gyms have a Smith machine. So that's the bar that lets you adjust. It's a squat rack that lets you adjust the height of the bar, and it locks itself into place. So you could play with the height of that bar and use that as where your hands are going to start from. Now, if you're at home, obviously you have your couch, your countertop, your tub. There are several places that you can elevate your arms and reduce the work of your abdominal muscles. But what happens if none of those help and planks still hurt and you're not able to do your squats the way you want it, you're not able to lunge, and that you really just want to get over the discomfort while you're doing these planks? Well, that's what I help people do. I help people find the root cause for their specific lower back pain while they're doing the things that they want to do. So if your goal is to get back to planks, I can help you 100% figure out what it is. So is it something in your hip? Is it something in your low back? I mean, I've seen it be as weird as something going on in a foot. You know, so there are things sometimes that just cause your body to be off balance enough that something is being stressed at a point that causes pain. And I find that especially with back pain, it is so scary if you're doing something and you find that your back hurts, because obviously the ramifications of back pain are huge. And so people tend to avoid those like the plague, when really just looking at it and finding the actual cause of the discomfort and then correcting that can be the easiest way to get back to everything that you want and still get all the wonderful benefits from, in this case we're talking about a plank, from the plank. Again, if you're trying to overcome a butt wink while you're doing your squat, so that's at the bottom of your squat, your hips kind of roll under, planks are wonderful for training that out of you. Deadlifting, a lot of people kind of roll at the end. Being able to do a plank and keep yourself steady against a force is what helps you overcome that and be able to keep yourself steady no matter what weight you're lifting. If you're trying to get into lunging, and just to help, overall physique and balance and coordination and, training your right side versus your left side, being able to stay straight and upright helps really challenge your thigh muscles and helps you really create the better development in your thighs and your hamstrings. So again, planks are wonderful. So if you're just having a little bit of back pain, having somebody come and help look at what's going on, help you if, with manual techniques or just learning how to do something a little bit different, altering something, and getting you right back out there so that you can keep doing the sports and the activities that you want without having pain. So I hope that you're having a good day. Bye.